A long-term study from the University of Alberta that looked at 11 million emergency room visits across the province showed that Indigenous people were not treated the same when being triaged for care. In some cases, the numbers are jarring. 33% of Indigenous people were triaged as less urgent than other patients. Now, the University of Alberta is beginning a 4-year project to help change those numbers. Dr. Esther Tailfeathers is a physician at the Kainai tribe in southern Alberta, and she is co-leading the project.
We've heard for years the stories from Indigenous people about the bad outcomes. Either they leave before getting seen because of their treatment, or treatment that is suboptimal and results in either greater morbidity or mortality.
8 Indigenous communities and organizations from across the province will be partnered with emergency departments in the project. It's an effort to ensure that Indigenous patients are receiving proper care and treated with respect. Dr. Patrick McLean co-led the triage study and this new project.
We think the core part of the project will be to build relationships between First Nations and the emergency departments that we select for the project, so that the First Nations can direct what needs to change in the emergency department, and really having those regular meetings and relationships between the department and the nations so that the departments are accountable and responsive.
We have to call out where we think these problems exist. We have to address them in a systemic manner. And we have to come together at the end and figure out how are we going to make things better, because at the end of the day, we want to change the health outcomes of Indigenous people across the country.
Meetings have already taken place and feedback has already helped.
We believe education of the providers is going to be part of the solution. So just culturally safe practices, not relying on stereotypes, seeing patients as individuals.
Dr. McLean hopes the project will lead to equal treatment for everyone when they visit an emergency room.
In an ideal world, it goes really well. Patients report fewer experiences of discrimination, better access to continuity of care after the ED, and then we can spread that to other hospitals in Alberta.
And create a framework that can be used at emergency rooms across the country. Chris Stewart, APTN National News, Edmonton.